Hello, I'm from the team Paradox and I'm show you to the our prototype. So chronic disease like type 2 diabetes often develop silently. By the time symptoms appear, treatment becomes expensive and outcomes worse. Clinicians work under time pressure and patients often don't understand probabilistic health risk. So our goal was to design an AI-assisted clinical decision support system that detects early diabetes risks using routine health data while keeping doctors in control. Our solution is a Streamlit-based preventive risk assessment tool with two modes. One is patient assessment interface and second is doctor dashboard for longitudinal monitoring. The system transforms structured patient data into an explainable risk probability and suggests preventive next steps. Here, I'm click on patient assessment and I'm selecting one language out of English and Hindi. I'm selecting English and then click on continue. And here are some personal details I'm entering like my full name and my mobile number. Random you enter any and then click proceed to health assessment. Here, basic routine data is entered like age, BMI, blood glucose, blood pressure, smoking history, and medical background. Like patient history is already entered, and I am entered my basic information such as gender, age, high blood pressure, heart disease, smoking history, and some clinical measurements like BMI, hemoglobin, and blood glucose. Once we click check my diabetes risk, the system generates a risk probability, a risk category, an urgency level, and an AI generated health explanation. Like normal, this is normal, and this result is 0.01%, urgency is none, and no immediate diabetes risks, maintain healthy habits. Importantly, this is not a diagnosis, it is a screening aid. And then a small short AI health explanation like based on your health details, your diabetes risk is low. Some factors affecting this risk, healthy eating, dieting, walking, and regular checkups can help reduce future risks. The explanation is simplified for patients focusing on lifestyle factors such as diet, physical activity, and metabolic monitor. Back to home page. I'm clicking on doctor login. I'm entering doctor details, login details like username doctor1 and password. Click on login. For clinicians, we provide a structured dashboard. It includes risk probability, risk category, contributing clinical drivers, recommended next steps, and longitudinal monitoring capability. Like these are the patient records. Some patient records, patient ID, name, mobile, language, gender, smoking history, risk category, and review. And I can also review patient history, like selecting patient ID and risk overviews, like risk probability is for this patient is 2.9% and risk category is low. Currently, if historical data is limited, the system clearly states that trend analysis is not available, maintaining transparency. And there is also a short AI health explanation like predicted low diabetes risks, key contributing factors, and this assessment should be used as a screening aid and recommended lifestyles. Next, recommended next steps. What you will to do. Like continue routine annual screening and maintain healthy diet and physical activity. This ensures the AI support decision making without overwhelming the clinician. And you can also generate and download PDF report. Okay, so when I am clicking on the download button, the report is downloaded and it shows like diabetes risk assessment report. It includes patient details and some clinical measurements like I have entered BMI, blood glucose, and hemoglobin, and the risk outcome, like risk probability and risk category, and a short AI explanation, which is for patients. And this report is for information purpose only. It does not constitute a medical diagnosis. And like it generated on 8 Feb 4:30 p.m. Like it shows date and time. What makes our system different is it provides explainable AI insights. It separates patient communication from clinical communication, focuses on prevention, not just prediction, and it maintains safety discriminate and avoid automated taxes. This aligns with real-world OPD workflow where decisions must be fast, interpretable, and responsible. Our system can routinely help data into early, actionable, and explainable risk insight, enabling proactive intervention and strengthening human AI collaboration in preventive healthcare. Thank you.